Matthew Walker Comprehensive Health Center is proud of its name and the man who it represents. Born in 1906 in Louisiana, Dr. Matthew Walker moved to Nashville in 1934 to begin his medical training. For 30 years, he was the chairman of the surgery department at Meharry Medical College. He was pivotal in expanding the surgery program at Meharry, where he personally trained half of black surgeons in the U.S. during his tenure. His desire was to provide access to medical care and jobs for the underserved and uninsured in Nashville. He founded Meharry Neighborhood Health Center in 1968, which was later renamed Matthew Walker Comprehensive Health Center. The center has grown from a single facility to a community staple of comprehensive health across 3 locations throughout Middle Tennessee.
He would travel to Mount Bayou, Mississippi to help train other black students at the time because they could not be trained in the hospitals there because of segregation.
A goal of his that has now been in motion for more than 50 years at all 3 of Matthew Walker Comprehensive Health Center's locations. Matthew Walker is open to all, but it also helps reflect the community it serves with their diverse group of medical professionals.
We are a diverse organization. We make sure that our offices represent the communities that we serve.
Elizabeth Frazier, now a patient at Matthew Walker, explains how it has actually been a staple in her life for decades.
Matthew Walker was a place that I would refer students to, those who didn't have insurance and even those who did.
The Community Health Center provides many services for their patients to help make it a one-stop shop for those in need.
In Nashville, we have what we consider the full comprehensive model of services. And so along with primary care services that are provided by physicians and certified nurse practitioners, we also have a significant oral health program that includes 4 dentists, 2 dental hygienists, and now 6 dental residents in partnership with the University of Tennessee and Ascension. We also have lab services, which includes plain film radiology and mammography. We have on-site laboratory services, pharmacy services, behavioral health services, which includes opioid addiction treatment services. We have social services, case management, outreach and enrollment. I'm always forgetting something, but as you can see, those services are very inclusive to meet the needs of an individual.
They also support their older group of patients with different programs and activities in which they can participate in.
Seasoned adult programs are educational, they're fun, they're mind challenging, they create a sense of togetherness that a lot of people don't get because they don't have family that is close by or that is even living, but they're like family.
Along with their services, safety and awareness are also some of the most important things to the Matthew Walker team. As 2020's coronavirus pandemic set in, Matthew Walker knew they had to take action to keep their patients and staff safe.
We will continue to make sure that we have masks available for our staff and for our patients in this environment, that we are diligent about our cleaning, that we have our supplies on hand, that we're able to clean our lobbies and our chairs, and that we don't crowd them back.
Increased measures have been taken for staff and patients alike to ensure that safety.
Matthew Walker has not turned its back on the community. They have constantly came up with different ways to make it safe. The mask, 1 person at a time, meeting you at the door, speaking to you ahead of time, providing the hand sanitizers, the mask at one time. Now they ask people to bring their masks with them, but most of us now have masks. So they have been doing a great professional job.
As mentioned, the healthcare center is open to all, but some still sit in the stigma that affordable healthcare means lesser quality, which is not the case. Patients like Meredith Pittman even took the time to write a letter to the practice expressing her gratitude for how comfortable the team made her feel.
Initially, when I wrote my letter, I was just talking about, from the time you walk in to the lady that's actually down there now, who is, doing her job and testing, taking temperatures, for COVID and everything, to the people at the front desk and, where they send you. Everybody is just so friendly and they make you feel so comfortable. And that's very rare.
As the world continues to navigate its new normal amidst a pandemic, one thing is staying steady: Matthew Walker and its mission to serve all.